There's a really interesting concept in primary care called group wellness visits, and I would love to hear you guys' opinion on what you think of this. So this concept is that in a certain age group, there is a group of patients, well, in babies, that start off together at birth, and say there's 5 or 6 families and they're put into a cohort, and that cohort comes to all of their wellness visits together, and they meet with a nurse and they go over developmental milestones, anticipatory guidance, just kind of basics for that month. They can talk about breastfeeding and solids, tummy time, all of that anticipatory guidance, go over what's normal, what's not normal, and answer questions. And then each family gets a few minutes individually with the medical provider, the doctor, or the physician assistant or nurse practitioner to go over their child's specific growth and development to see if there's anything medical going on. And this is a way to try and take primary care and not do everything with the provider, but to break this up into different parts. The studies show that this actually helps parents feel more engaged in their child's wellness care. They get more education, they learn from each other, and they actually enjoy going to their wellness visits. There's also some perspective that this can actually increase how many patients your providers can see and increase accessibility and decrease cost. This is done in a lot of other countries, but the United States has pushed back on this a little bit because we see the only medical advice that really matters to families is what comes directly from their PCP or medical provider. And so they want that person to be the one that does all of the education. And while I certainly understand that, it's no longer really feasible. So what are y'all's thoughts about, would you be interested in a group primary care model? Would you sign your child up for that? Would you want to do it? And if you have an area of the country that does something similar, how has it worked?